My name is Pui Lee. I'm a pediatric rheumatologist at Boston Children's Hospital. I was trained in the medical school at University of Florida. I came to Boston Children's Hospital for a residency in pediatrics, and then I stayed here for a fellowship in pediatric rheumatology. And I've been practicing since 2016. In addition, I am an immunologist by training, so I run a small lab, and our research is focused on systemic juvenile arthritis and also some monogenic causes of autoinflammatory diseases in children. So JIA is the more common condition we see in the clinic in pediatric rheumatology. And once you have a diagnosis of juvenile idiopathic arthritis or JIA, I really think that's a transition from a diagnostic journey to the beginning of a therapeutic journey for many children with joint inflammation and arthritis. The family could be relieved to have an answer, and they can also be very stressed out, right? Because now we have a lot more information to deal with. But in any case, right, you will receive lots of information from a pediatric rheumatology provider, and just pay attention to every case also unique. But what is important to know is the vast majority of children with juvenile arthritis do very well once they get on the right treatment. That means they live a very normal life. They go to school, they participate in sports and other activities they enjoy really without any restrictions. Many of my own patients, they're now adults, right? Some are in college, some have even started their own family. So most of them have no limitations or consequences from the time they have arthritis during childhood. So that's really an important reminder that these kids do very well in the long run. In most cases, the doctors and providers will talk about starting medications for treatment of juvenile arthritis. There will be lots of information because there are now lots of medications that have demonstrated to be very safe for long-term use in children. So it depends on the type of arthritis, the severity of arthritis, to dictate how much treatment and which treatment the patients are offered. Some are oral medications and some are injectable medications that are what we call biologics. But because the medications are all different and cases are different, but we do have very similar goals, right? So the goal is always to have the patients, children, right, live a very normal life on the least amount of medication to keep the arthritis in remission. And you will see the rheumatologist every few months to make some adjustments, right, on the medications, whether it's to increase or to decrease based on how the child is responding to the treatment. And we often also refer children with arthritis to some of our colleagues, right? One is ophthalmology. They need an eye exam because some of these patients also develop inflammation in the eyes. It's very similar to what is seen in the joints. In some cases, we work with physical therapy, right, to help children regain their strength and also the joint function. Now, I just told you lots of information. You probably won't remember everything, but your providers will always be available for follow-up discussion. You can also look for information on trusted sources like the ANRF. To this day, we still don't know what causes juvenile arthritis. We call it idiopathic, right? Because we don't know the answer. And so research really the only way to get there. So whether it's contributing to a research study that's existing by giving data, a blood sample, or participating in a clinical trial, these are all ways that families and new patients with diagnosed JIA can help us solve this puzzle together in the future.